The World Health Organization's Director General Tedros Adhanom Ghebreyesus stated on Wednesday that the resolution the UN Security Council enacted last week, which called for more help to be sent to Gaza, has yet to have an impact. Following days of discussions behind closed doors, the UN resolution adopted last Friday called for humanitarian pauses between Israel and Hamas, more relief to Gaza, and the establishment of conditions that will allow for a durable stop to conflict. However, Tedros stated that it had not yet materialized in the ravaged strip due to conflict. UN Security Council members must urgently turn the recent resolution to create pauses in hostilities and humanitarian corridors into reality in Gaza. Actions, not words, are what Gaza's people need today, Tedros said in a post on X, formerly Twitter. Day after day, the needs of Gaza's war-ravaged people grow. Peril, ill health, hunger, thirst, lack of shelter, these should not be the norm for millions of people. But sadly, they are. WHO warnings. Tedros' remarks come after WHO teams carried out high-risk missions to deliver supplies to 2 hospitals in Gaza. In the north, UN teams brought medical items and fuel to the Al-Shifa hospital, where a reported 50,000 people are seeking shelter, to keep essential health services running at the hospital, WHO said. Teams in the south visited Al-Amal Hospital, where WHO staff said they found it impossible to walk inside without stepping over patients and those seeking refuge. While transiting through Gaza, teams also witnessed tens of thousands of people fleeing heavy strikes in the Khan Yunis and middle area on foot, riding on donkeys or in cars. WHO Representative Rick Peppercorn said the agency was concerned the new displacement of people would strain medical facilities in the south even further. This forced mass movement of people will also lead to more overcrowding, increased risk of infectious diseases, and make it even harder to deliver humanitarian aid, Peppercorn said. Tedros echoed his concerns. Today I repeat my call on the international community to take urgent steps to alleviate the grave peril facing the population of Gaza and jeopardizing the ability of humanitarian workers to help people with terrible injuries, acute hunger, and at severe risk of disease, he said. The UN resolution for increased aid to Gaza, approved last week, has yet to show impact, according to WHO Director General Tedros Adhanom Ghebreyesus. Urgent action is needed to translate promises into relief on the ground, addressing the escalating needs of Gaza's war-ravaged population and supporting crucial humanitarian efforts.